Welcome, everybody. We're so glad to have you join us for the first session of the Region 7 Maternal Health ECHO. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. And I'll just be kicking us off with a little bit of front matter before we launch into our session. So a little bit about KHI before we start. KHI, or the Kansas Health Institute, is a nonprofit, nonpartisan educational organization based in Topeka, Kansas. And we were established in 1995 with a multi-year grant from the Kansas Health Foundation. We're guided by the vision that Kansas will become the healthiest place to live through evidence-based and innovative strategies, policies, and practices. And so a lot of our work you'll find revolves around research, evaluation, technical assistance, and policy analysis, and also educational offerings such as ECHO series. And so we do have the Ad Astra ECHO Hub, which we are launching this series through. And with that, it is my pleasure to pass it over to Shelby Rao, who will be leading today's session.
Thank you so much, Rebecca, and thank you all for joining this important conversation today. So to kick us off, I'm going to take us through our agenda. We've started with our welcome, and after this, after a few quick slides, we'll go immediately into our didactic presentation with Tracy Russell. We will then go into our role-based breakouts, and we'll go ahead and do a quick poll here just to get a better sense of what roles do you really feel most aligned with? So you'll see a poll come up on your screen. If you could respond to that, that'll help us kind of plan with our facilitator breakouts. Next, we will go into our problem of practice presentation and discussion. Finally, we'll go through a whole group share out after you've done your breakout groups for both those role-based group breakouts as well as the problem of practice. And then at the end of today's session, we want to give you guys time to share what's going on in your corner of Region 7. So if you have any announcements or exciting things that are going on with your work, feel free to share during that time. And then we will close with a reminder on CEUs as well as our feedback survey. So, this ECHO series is intentionally designed to bring together diverse voices from across the maternal health space because no single sector can solve these challenges alone. Our four key participant groups are community members with lived experience, community organizations, clinical professionals, as well as state and local level staff. So, looking at health departments. The goal of this cross-sector collaboration is to learn from one another, share what's working, and collectively strengthen maternal health equity across Region 7. So, what are our overarching objectives of this maternal health echo? We want to make sure that we're using actionable strategies to engage mothers and community voices in shaping service delivery and evaluation. We want to build networks across Region 7 to share practices, resources, and data informed insights, leveraging community-based approaches such as collaboration with CHWs, doulas, and lactation consultants with clinical systems. And then finally, we want to identify and share strategies to address region-specific maternal health barriers within Region 7. So, giving a quick overview of what this session includes. So, we will have a session each month from now until the end of October. This is our first session, so you've joined at the perfect time to really get a great view of what's going on within Region 7. It isn't a requirement that you attend all sessions, but we do encourage that you attend as many sessions as possible so that we have the opportunity to get to know each other and collectively build off the learnings from one session to another. So next, I want to give a brief shout out to our Ad Astra Echo Planning team, which includes myself, Avanti, Rebecca, as well as Misha, all of who are on the call today and will be doing various roles during our session today. Next, we have our Echo Hub team. I'm not going to go over the entire list, but we do have a very large hub team from across Region 7 that really spans across all sectors within the maternal health space. So you'll see our Kansas and Nebraska hub team members here. And then on this slide, you will see our Missouri and Iowa hub team members here. So thank you again to our hub team. Next, we've developed a resource guide so that you can have access to all of the different resources that are mentioned today so that you can continue exploring this topic. In the chat, you'll find the resource guide PDF that contains the resources mentioned today, along with the discussion questions and a note-taking space that you can use to guide your reflection on the topic or conversations that you have with your organizations in the future. So, without any further ado, we will be going into our didactic presentation. I am so excited today to introduce Tracy Russell, who is the Chief Executive Officer at Nurture KC. Tracy is a University of Kansas graduate who returned to the state after the birth of her oldest son. She has worked in legislative policy for 30 years with nonprofits, including the Iowa League of Cities, American Cancer Society, and American Heart Association. Some of the highlights of this work include the passage of a statewide clean indoor air law in Kansas, as well as the passage of a tobacco tax increase. Tracy currently serves as CEO of Nurture KC, an organization that is committed to reducing maternal and infant mortality in Kansas City, a position that she has held since 2019. Tracy brings a policy lens to Nurture KC, recognizing that is a combination of direct services, community collaboration, and policy change that bring cultural shift and broad impact. During her tenure, Nurture KC has expanded services to include doulas, mental health counseling, and transportation to appointments. Nurture KC has also participated in successful efforts to expand Medicaid in Missouri and extend postpartum Medicaid coverage for mothers and cover doula services in the Medicaid program in Kansas. Tracy's latest project is leading a legislative effort in Kansas to adopt paid family and medical leave. So, thank you so much for joining us today, Tracy. We are so excited to have you with us, and I will turn it over to you for your didactic presentation.
Great. Thank you so much. I am thrilled to be with all of you today, and thank you for KHI for convening on this very important topic. As you can tell from the remarks earlier, I've actually worked or lived in 3 of the 4 states participating today, so quite familiar with what happens in our region and the unique challenges that we face, as well as the opportunities that we have too. So with that, before I get into kind of the specific thoughts around collaboration, I just wanted to talk about Nurture KC a little bit, what we do. And we are a small nonprofit. We have a staff of 10, and we incorporated in 2001. I'm actually just the second CEO. The founder was the original, and I give her a lot of credit for recognizing this issue of maternal and infant health and wanting to respond to it in our area. We are a bi-state organization, so through our Healthy Start program, which is our flagship program, we serve both Kansas City, Missouri, and Kansas City, Kansas. And specifically, we serve the 12 zip codes in the metro with the highest rates of infant mortality. We serve 700 participants a year through that program. And then in addition to that, we also run a vaccination program as well. And so we're in the mix. We are collaborating often in this spaces, as I know all of you do. And as I kind of sat down to think about what I wanted to talk about today, you know, it just feels like it's so baked into what all of us do that it really took some narrowing down to kind of highlight what I think would be beneficial for the group today. And even within our organizational mission statement, our first sentence is Nurture KC is a community collaboration. I personally believe very strongly in that, and hopefully, you know, you'll get some tips for today. I will say I don't always practice what I preach, and that was another learning experience for me with pulling this together in terms of, okay, we need to lean into this a little bit more organizationally, or I need to personally. So within our Healthy Start program, there are kind of 3 pillars of service that we provide. One being those tangible items, so cribs and car seats and diapers, We also emphasize education within our program, including developing a reproductive life plan. And then we also provide many referrals and resources. Children in our program are in until they are 18 months old, at which time we do a warm handoff to other organizations. So, it's critically important that we know our partners within the metro and that we have those relationships to feel good about who we're referring to. And then just in the last couple of years, I think we've done 4 years now with providing doulas to any participating mom in our Healthy Start program. And to do that, I contract with 2 doulas. A substantial portion of our population that we serve is Spanish speaking. So I have 1 Spanish speaking doula and then 1 English speaking. And the same goes for the counseling services we offer. We offer group counseling as well as individual counseling, and that's given in both English and Spanish as well. Okay, so I'm going to start with just kind of some case studies around collaboration and then talk about what I view as kind of the optimal circumstances for collaboration and other instances that might give you pause and what some responses to that might be. So the first one is really national in scope, as we talk about how to work across state lines. I thought this was an important one, and I'm sure this is one that many of you are experiencing right now. At this time a year ago, Healthy Start was really facing an existential crisis in that we had been recommended for elimination as a program, and there wasn't really a concerted, centralized, and coordinated effort to keep us in place. And so as a result, because of my policy background, I thought, well, I could help lead an effort like this. So we did organize a trip to Washington, D.C. to speak with our federal lawmakers, and we had about 15 states join us in that. And we had done a deep dive into lawmakers' voting records, some who might not on the surface appear to be supportive, but that we thought could be supportive if approached. Internally, my staff and I had met with our own delegations. Many of them had actually been to our office. So we felt comfortable in that space. And ultimately, working in concert with those other Healthy Starts allowed us to get to the folks that we needed to on the Hill. And ultimately, we were fully funded. And, it's often kind of a squeaky wheel philosophy. If you're not making any noise, then you become easy to cut. And certainly we can continue to see this happening in terms of investment in maternal and infant health. And so, I think one of the biggest lessons learned from this was, at that particular moment, it was just critically important that we shift what our priorities were. I think all of us would say we're busy all the time. It can get difficult to kind of juggle, but when you're facing a threat like we were, other things have to fall to the side, and we have to be able to pivot when we need to. And I think the other important lesson, which you'll hear is kind of a resounding theme through my remarks, is knowing what your particular role should be. Now, in this case, I had experience in this. I knew that I could help provide some comfort to others who maybe weren't as experienced. There's also some freedom that comes with being a community organization as opposed to a government entity, in that I've got more latitude to engage legislatively. And so I felt like we were filling a void that needed to be filled. This particular case study is around a partner organization of ours, and it's called Promise 1000. It's here in the Kansas City Metro, and they too are a bi-state initiative. Nurture KC became the fiscal agent for Promise 1000 about 3 years ago now. And in that capacity, we provide a lot of administrative support. We have applied for joint grants and funding, which I'll talk about a little later. And then there is a referral system that is metro-wide that Nurture KC is a part of. So with Promise 1000, we have become a referring agency for participants who might be geographically close to us and need what we might be offering. The other thing that we've taken on with Promise 1000 in terms of our specific collaboration is with our Healthy Start grant, we are required to provide continuing education, but those cannot be enrollees within our program. So it has to be other families outside of the Healthy Start program. And so they have been a wonderful audience in terms of allowing us to do more community education. And we've covered everything from adding produce for a healthier diet to soft parenting during hard times, family financial literacy, and count the kicks. And so I think without us initially becoming the fiscal agent, I'm not sure if any of these other initiatives would have been possible. And, I think it's been great in terms of getting us out of the silo a little bit. In terms of lessons learned, I think for me, I was probably a little fuzzy in terms of understanding the scope of this particular collaboration, because they weren't kind of coming under our umbrella as a program. They maintained their independence. And so what we looked for instead was where our interests overlapped and we could help each other out, that we do that. So it's very much a reciprocal relationship. And I know that some of you put that in your chat at the beginning of this. I think that's critically important, that it doesn't have to be a collaboration that's controlled by one entity or another, that often it works better to maintain that independence, but know where you can come together. And then the second lesson with this was really navigating the funding landscape that often may not be as conducive to collaboration. Promise 1000 is a true collective in that they are providing funds to a group of 8 other organizations to carry out the mission and goals of improving maternal and infant health. And so as agencies might get separate funding, they're trying to bring in funding for all these groups and getting us all rowing in the same direction. So that's definitely been a challenge and a lesson learned. So this centers more around a service collaboration. I think now more than ever, vaccines have become critically important. We saw the impact on moms and babies, particularly during COVID, and what we continue to see with measles outbreaks and such. And I think there's a real need at that very local level, and particularly from a public health perspective, that we continue to emphasize the importance and the efficacy and the safety of vaccines for family health. So for decades now, Nurture KC has coordinated free flu clinics across the metro every fall. We added COVID vaccines in recent years to that as well. And this is a long-term collaboration with Walgreens that we have done. And the reason why it works is that we partner with other trusted entities in the city. We do at least 10 clinics with various partners every year. And it is so helpful because they're much more likely to be able to meet their constituency than what we may be able to do. We also do coordinate one clinic for our Healthy Start participants too, to make sure that we're bringing them into that mix. But, I think this has been an opportunity to bring in some non-traditional partners. For instance, we're looking at doing a free clinic with the senior population this fall. And I think it builds a lot of goodwill across the metro to be able to do this. And it's a very important, tangible item and service that can be provided. And as I mentioned before, I think it's a great opportunity for health systems, public health, and community organizations to work together. And we've certainly worked with all those entities in this process. So, Nurture KC's Community Consortium. This is probably the most public-facing entity that we have, and it's really established through our Healthy Start grant to address social determinants of health. And I will tell you in all frankness that I initially had some misgivings about this, and I'll talk about that shortly. But it has turned out, I think, surprisingly well. My concern mainly being that anytime you aren't really given specific goals, it can be hard to get people to participate and maintain participation for the long term. I think all of us on this call could talk a lot about all the issues with maternal health. But as we know, that's just the beginning of the conversation. And so I do have a community engagement director who leads this effort. And what she has done is specifically hone in on the topic of housing in the city and given them something concrete to focus on. And so they track that through policy happenings in the State House. They have done home buying clinics for people. They serve as an aggregate for housing resources across the metro. And while they've kind of designated this as their issue of interest right now, somewhere down the line, they could always change that as needs arise in the city. I think the other thing that's been important about this consortium is we have worked very hard to incorporate our Healthy Start families into that consortium. So we've got public health, we've got hospitals, we've got community advocates, local government, and most importantly, Healthy Start participants who can talk about what that lived experience is. And one of our participants actually co-leads our consortium now. And I think it's very important that we give families the opportunity to talk about what they face and what they need. And it just gives more meaning to the work. And I feel like we're addressing these issues better. And I would say kind of the final lesson learned there was the work has to occur between those meetings. And I think sometimes that's the toughest part when it comes to collaboration. But what you don't want to do is feel like you're starting over every time you meet. People want to see progress, and they will participate if they can see momentum and activity occurring. So here is a policy collaboration. So Nurture KC is part of the Paid Leave for Working Kansans Coalition. We are trying to establish a state law that would grant 12 weeks of paid leave for the birth, adoption, or fostering of a child, for senior care, and for serious medical condition. And we have now been working on this through 2 legislative sessions, and I'm spearheading the legislative side of this. But I think what was important in this work was we really put some structure to it because we knew it was going to be long-term and that we all needed to be moving in the same direction with this. So we actually signed a formal agreement as members of the steering committee. And we've got about 8 partners on the steering committee, all from kind of different aspects of the leave umbrella. And We did hire a dedicated coalition coordinator. And again, I think that was a recognition that because this would require so much work, because it's such a cultural change, that none of us as members of the steering committee could devote as much time to this as we would need to make it successful. So as soon as we could find a grant to cover the cost of hiring a coordinator, we went ahead and did that, which was an important lesson for us. And then I think just making sure that everyone was aware up front of what everyone's role would be, what their experience is and their expertise is, was very helpful, because we broke it down into buckets where I lead the legislative effort, someone else leads kind of the business case, trying to recruit businesses to this effort, and then someone else leads our grassroots, so that it didn't seem like one person had to take on every role. And I think maintaining those regular meetings was very important for keeping everybody in the loop. And then, you know, here's a point that I think is really important, that I think can often be controversial when it comes to collaboration, but you have to weigh decision making by balancing the consensus and recognizing that as you have given responsibility to certain leads, that their opinion should carry a certain weight in those conversations, that, you know, they're bringing the context, they're at every meeting. And, you know, I think sometimes it can be difficult for people to say, well, I have just as much say as somebody else. And yes, you may, but I do think for the functionality to be there, you really have to decide what your role should be within the larger group. So I'm going to get into just some more general terms about what I think are keys to successful collaboration. First and foremost, and this is just common sense, but the issue, project, or ongoing work must be central to your mission. If it is outside your wheelhouse, I don't think you should feel obligated to participate. And I think often it can be easy if someone asks us, you know, to get involved and we know them and we want to be there for them. But I would say that you are better serving the community at large when you're doing what you're best suited to as an organization. And then this next one is what I alluded to just a few minutes ago. Every collaboration does have an internal hierarchy, and you need to determine if that's acceptable to you. There are plenty of instances where I am happy to play a supporting role to whatever needs to happen. And none of us can be the lead on every coalition that we participate in. It just wouldn't be workable. And that's fine. That's how it should work. And I'll just give an example. When Missouri was working on their ballot initiative to expand Medicaid eligibility, I had been asked if I could kind of serve as one of the press spokespeople in the Kansas City area when it came to the impact on maternal and infant health. Very appropriate role for me. I knew I wasn't going to be out there leading the effort to expand Medicaid, but I did have a role to play, and I did that and was happy to do so. The next thing I wanted to talk about was making sure that staff has the agency to collaborate independently of the lead of an organization. You know, I think ultimately we have to recognize that it is the entity that is the collaborator, not an individual. And that way you can ensure that your work continues even if you might depart. And it just gives you, I think, more trust and more reach if you've given that agency to your staff. And then one more is recognize that not all collaboration will be reciprocal, and that is okay. there are often times when you might be asked to sponsor an event or speak or send a letter for someone. They might not have the ability to provide that same service to you in kind. And I would say if you have the capacity to say yes, go ahead and say yes to that. You know, we're not keeping score of who does what when. I find that comes back tenfold over time if you can get to yes. Next slide, please. So a few more keys for successful collaboration. And I think this is extremely important. Recognize the organizational structures of other systems and be prepared for that. A hospital system or an educational institution or governmental entity will more likely have more processes than what a small nonprofit does. And so you need to weigh that timeline and what you've set for goals to reduce frustration on all sides. And I will say that a few years ago, we had taken on a project internally of getting our area hospitals Safe Sleep certified. At that time in the Kansas City Metro, we just had 2 hospitals that had that at the time. And we knew as a leading cause of infant death that we needed to work on that. And, you know, in my mind, I was like, oh, well, this is the low-hanging fruit. We can get this done very quickly. And 18 months later, we were kind of wrapping up that project. Now, in the meantime, we were able to get 6 more hospitals certified, bringing the total up to 8 for the Metro. But it just taught me so many lessons. First and foremost, I had a former labor and delivery nurse on staff at the time who ran that project. So she was quite familiar with the workings of the hospital and could just speak that language. And I think one of the keys is knowing who to go to within those big systems to have the greatest impact. You know, being able to differentiate between who's on the clinical side versus who's on the health equity side and who's the best person to talk to get that moving. Now, because we didn't have a set timeline on this, it worked out just fine. And we tried to make the project, you know, as easy as possible for the hospitals to get that through. But, you know, I think knowing your partner and, you know, the strengths and challenges that they might have is quite important to any collaboration. And we were thrilled to get it done because we knew as kind of that first point in the safe sleep journey, hospitals were critically important to that. And then I would say, as just kind of a final point on collaboration, consider the partner culture in your area or state. You know, is maternal health led by state and local public health? Is it hospital systems? Is it community organizations? Hopefully it's all of those, but I think it really varies by state. And so, you know, making sure that you've got good and trusted relationships with those who are ultimately going to have more say in movement on any of these issues is extremely important. So I want to talk just briefly about a few warning signs when it comes to collaboration. This first one is probably the one that I look at a lot. And I think in part that comes because I have a political background, so I'm used to looking at, okay, what do we want the impact to be? So collaboration without definition. If the collaboration is just a meeting to talk about barriers, and there isn't the goal of identifying activities or actions that need to be done, for me anyway, it may not be worth my investment of time. That's not to say that there aren't instances where you're starting from scratch and you need to talk through what the issues are. But if you find that your meetings are all looking alike and it seems to be a recitation of the same things, that maybe that's not the best use of time. The second one is duplication of effort. And that is when a project or an issue or a funding opportunity presents itself, the first impulse may be to create a new effort without exploring what's already being done in your community. And that can create resentment among potential partners, as well as place new burdens on your organization if you're having to recreate the wheel. I always look for existing efforts that will make better use of my time. And I would go back to the Paid Leave Coalition. That was in existence when I joined it. I didn't start that effort. And I think it's important that we definitely dive into what's already happening in the community and join in rather than create if possible. And then third is the lack of opportunity for meaningful input. You know, if you've ever been to a meeting where all the decisions have been made and there really isn't the opportunity for true collaboration, I tend to shy away from those personally, because to me that isn't really community input. And then finally, and obviously there's going to be an unequal division of duties with whatever collaboration you're in often, but if it starts to feel like it's those school project days where you have a lot of responsibility, but it's not evenly meted out, that becomes an entity, that becomes an issue. And you may want to rethink the structure and the dynamics of that. And I do believe there truly has to be accountability with workload among the group. And that's really what makes any type of collaboration work. So we can't talk about working with others without talking about conflict resolution. And there will be differences to navigate within any group dynamic. My preferred method was I will generally start with a trusted partner who's accustomed to working with me, knows what we do, and then from there develop, okay, if we could have anyone we wanted to participate in this, who would that be? And that should always include some new faces and new ideas. As I've mentioned throughout, establish what the clear goals, expectations, and responsibilities and decision-making will be at the beginning, and you'll run into much fewer issues down the line. And then I would say, consider an entity's capacity to meaningfully contribute. You don't want to set anyone up to fail. And I think you're looking at, is this an ongoing collaboration, or is this, we have to meet this moment right now? Who can best help us to do that? And so while I think we all want to raise other groups as we go down this path of maternal health, I think it's important to recognize what is the best situation for someone given the circumstances as they exist. And then I do like to meet with potential participants if I'm starting a group, meet with them one-on-one before bringing them into the larger group. And then, I think conflict is inevitable at times. And for me, I like to have a separate conversation and not just throw it out to the group for the pile on, so to speak, and determine if the conflict is stylistic or if it's substantive. If this is a personality thing or something like that, try to figure out a way to work with that. If what you discover is that your goals and what you want to pursue is completely different and it becomes a bright red line for you, then that's something that you may have to rethink. And with everything that's on this list, it's kind of running through my mind, okay, yes, I had this situation at one time and had to respond to that. So we have to talk about funding whenever we talk about collaboration. And many of our funding structures seem to create competition, not collaboration. And at the same time, we're in this perfect storm where there are threats to maternal and infant health funding at all levels, at a public health level, at a hospital system level. When you look at the closures and reduced labor and delivery at our hospitals, particularly in rural areas, although we certainly have them in urban areas as well, and threats to community organizations. And so, these demands on funding have never been greater. And we really do have to look at how we consolidate our efforts. And that kind of goes back to, you don't have to create a new group to do what you want to do. Chances are it probably already exists. And I do think much of the funding can emphasize starting something new. Everybody wants to fund the bright, shiny object, right? Rather than contributing to something that is just kind of ongoing, on the ground work that we know is so important and long term to what we need to do. So I do think we need to be cautious of chasing the funding and adapting what we do as a result. For example, at one time, I know that we had a group focused on kind of teen mental health. And I thought, well, we don't have expertise in teen mental health, but it was chasing funding. Whereas I do believe if we focus on our highest and best use, that funding generally follows. And then I would say, look for efficient ways to utilize the funding that's out there. I employ contractors for some of what we do, both for my doula services and my counseling, because I know I can't afford to have 4 other staffers full time. And it's, it gets you to the end that you need and the service that you need to provide without bankrupting you. As we apply for grants and such, I think there's always a temptation to think, well, I need to fund everyone within the coalition. What I would caution with that, and the way that I approach that, is I look for function and accountability. If there's something that a particular group can do that is strategic to what we're trying to accomplish, and they have agreed to the deliverables, then great. But I'm not one who wants to dilute funding simply by kind of paying everyone their share. But I think in terms of accomplishing your goals, lots of your partners are going to be able to help you do that. And it's important to share that funding in the ways that will most impact the work. So in conclusion, we all practice collaboration every day. It's just so baked into this coordinated work. And I think as we move forward, we're going to have to continue to work more and more strategically and with each other if we are to improve these outcomes. And then finally, know your role and what your highest and best use is, including when to forge ahead or to sit out. Thank you so much for letting me speak with you today, and I certainly welcome any questions if time allows.
Thank you so much, Tracy. This was such a wonderful presentation and so many great insights. I think for the interest of time, if you have any questions, feel free to put those in the chat, and Tracy can answer those in the chat, or after today's session, we can also get those questions sent off to Tracy, and provide those responses after the fact. So again, any questions, feel free to put those in the chat. And I'll go ahead and turn it over to Rebecca to kind of close us out on our last slide. So Rebecca, over to you.
Thank you, Shelby. And again, thank you all for joining us for our very first ECHO session of the Region 7 Maternal Health ECHO. It's been a joy and a privilege to be able to work with you, and we really look forward to seeing you again on July 28th for our second session, which will focus on bridging community and clinical approaches. So we will start that session providing a summary of the discussions that were had today. I know we were short on time and weren't able to fully do that, so we'll make sure to create space for that at the beginning of session 2. And then we'll be launching into the next topic of bridging community and clinical approaches. So we look forward to seeing you then. And then just wanted to also share on the next slide that if you're interested in additional resources from KHI, Check out our website, khi.org, for events, federal policy updates, and recent publications. Thank you so much for joining us for today's session. It was great to have you, and we look forward to seeing you on July 28th. Thank you all.